Hello friends, and welcome back to our channel. We're going to be discussing a very serious subject today, prostate cancer. Understanding the origins of this disease is essential for both early detection and prevention, as it affects a large number of men globally. The prostate, a tiny gland in males that secretes seminal fluid that nourishes and moves sperm, is where prostate cancer begins to grow. Although it's one of the most prevalent forms of cancer in males, what specifically causes it? Prostate gland cells can change and proliferate uncontrolled, leading to prostate cancer. The prostate is a tiny gland that produces vital components of semen and is involved in reproduction. These aberrant cells have the ability to move to other areas of the body and harm nearby tissue as they multiply. While the exact cause of prostate cancer isn't known, several factors can increase a man's risk of developing the disease. Let's break these down. Let's start with age. Men who are older have a much higher chance of prostate cancer. Men over 50 are diagnosed with the majority of instances. An increased risk of prostate cancer is seen in elderly males. Men should have regular screenings as they get older. Next are genetics and family history. A man's risk is increased if either his father or sibling had prostate cancer. This implies that hereditary variables are involved. In as many as 15% of instances of prostate cancer, a genetic component may exist. An increased risk applies to men whose family members were diagnosed with prostate cancer at an early age, 50 years or less. Indeed, genetics play a significant role. Prostate cancer risk is raised by some hereditary gene mutations, including BRCA1 and BRCA2. Although their association with breast cancer is more well known, these genes also influence the risk of prostate cancer. Ethnicity and race are important additional factors. Compared to men of other races, African American men are more likely to develop prostate cancer. Men of Asian background have a little lower risk than men of European descent, who also face an elevated risk. Additionally, prostate cancer in African American men is more likely to strike younger and present in more aggressive forms. A word of caution: remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. Let's discuss lifestyle and diet. Prostate cancer risk may rise with a diet heavy in red meat and high-fat dairy products and low in fruits and vegetables. Furthermore, there is a connection between obesity and an increased risk of aggressive prostate cancer. Prostate cancer risk can be decreased by eating a balanced diet and doing regular exercise. Unbalances in hormones may also be involved. Elevated concentrations of specific hormones, notably insulin-like growth factor and testosterone, have been linked to a higher risk of prostate cancer. Prostate inflammation or prostatitis and STDs may also raise the risk of prostate cancer, though the evidence for these two factors is not as compelling as it is for the other causes. Frequent sexual activity. According to certain research, having sex frequently may help prevent prostate cancer. There's also the exposure to specific substances. Prostate cancer risk may be increased in men who are exposed to chemicals, such as those used in the rubber industry or in battling fires. Prostate cancer is more common in veterans who were exposed to Agent Orange in Vietnam. Environmental factors, possibly including food ones as well, may come into play. For instance, despite their background, third-generation Japanese immigrants to the U.S. have a risk comparable to that of the typical U.S. male. Misconceptions and unknown factors. Although a number of risk factors have been discovered, the precise causes of prostate cancer remain unclear. It's crucial to remember that possessing risk factors does not ensure that you will get prostate cancer. In fact, some men may get a diagnosis even when they have no recognized risk factors. Prevention and early detection. What, though, can you do with this knowledge? First and foremost, routine examinations and screenings are essential, particularly if you're more vulnerable. The results can be significantly altered by early discovery. Recall that, with early detection and treatment, prostate cancer is frequently curable. Second, keeping a healthy weight, consuming a balanced diet, and engaging in regular physical activity can all help reduce your risk. If you have concerns about your risk factors, talk to your doctor. They can provide personalized advice and may recommend screening tests based on your individual risk. Understanding the causes and risk factors of prostate cancer empowers you to take control of your health. Stay informed, maintain a healthy lifestyle, and don't hesitate to consult your doctor about any concerns. It's important to note that these are just risk factors. Having a risk factor doesn't mean you'll get prostate cancer, and some men with no risk factors still develop it. That's it for today's video. We hope you found this information helpful. If you did, please give us a thumbs up and subscribe to our channel for more health tips and information. And as always, leave your questions and comments below. We love hearing from you. Thanks for watching and take care.